So COVID Near You is a crowdsourcing platform. The idea of trying to get insights on illness that are happening in the community. We know that we only get a tip of the iceberg of insights when we look at hospitalizations and deaths. We don't know about the broad amount of illness happening in the community. So if we're going to get insights into emerging hotspots or the impact of social distancing and really understand when we're at peak and when we're sort of on the other side of this epidemic, the idea of getting insights from people directly from the population really can improve our ability to monitor, track, and really implement a response in the best possible way. That information gets stored in a secure HIPAA-compliant server in the cloud, which we've used for many of the work that we've done over the course of many years. And also, the way that it's displayed never allows for an individual to be reversely identified because we're aggregating at the zip code level. And we know that testing is severely lacking in most parts of the country. So we can't just rely on confirmed illness as a way to understand the amount of cases that are out there in the population. So we're relying heavily on symptoms. Of course, if people have a positive test, that's really helpful for us, but really we want everybody reporting, even people that are healthy, because that gives us a really important denominator for us to do our analyses. We're relying on people self-reporting illness. We're also doing a lot of work through our health map tool to scrape information that's being displayed online. It's as real time as we can, but of course we can't capture all the data sources. So we've just actually expanded COVID Near You to Canada and Mexico. The demand for international use is just been overwhelming. So many countries have expressed interest in having similar tools. So we're now building the infrastructure to actually accommodate sort of global expansion. But of course, we're also hyper-focused on sort of really getting the most amount of coverage in North America at the same time.